All right, good morning, everybody. This is for the team. We have John Stark, and I know that speech language pathology evaluated him for any swallowing difficulties, and they have released him that he can tolerate liquid diet through a straw. And as the OT, I know that he has his right hand is in a splint, so we're going to start working on grooming and oral care and nutrition. So we just want to talk about what all the other disciplines have to bring to the table. So we'll start with you all.
So from physical therapy standpoint, Mr. Stark is very weak. He's been, pretty much bedridden. So we are going to be working a lot on just getting his strength improved, working on getting him to be able to get out of bed, transfer, start ambulating, and so he can get to the next stage of care.
Yeah.
So we're definitely going to recommend like walkers, a walker for him, and then probably a wheelchair too as well. Once he gets to that discharge point.
Yeah, so it's recommended that we co-treat at first.
Yeah.
Get him up and start getting him moving.
Okay, as a dental hygienist, I just want to ask a few questions if I could. So I'm to understand his right arm was casted.
Mm-hmm.
Do we know which is his dominant hand? Do we know that yet?
I think the report came back that he was right-handed. So we'll have to teach him some compensatory techniques on how to do his care with his left hand.
Okay.
Because he is non-weight bearing with his wrist right now.
Okay, thank you. And we know that he's experiencing some kind of double vision, and we know he has the intermaxillary fixation, so he is wired shut.
Mm-hmm.
And also, I noticed that he was somewhat combative. So I'm sure that when you guys do your care and you move him to when I do the treatment that we need to do, that I can reference all of you to determine his state of mind, so that I can provide him the things that I need to provide.
Right. So we'll have to go carefully and make sure that he's oriented, and move together, and he's going to have to have time to process, so that he can follow instructions.
Okay.
We'll see when we're getting up.
Okay. Thank you.
Mm-hmm.
As his social worker, I want to make sure that, all his basic needs are met, and that he has, his family is kept updated on what's happening. He wants that. He wants his family to know what's happening. Now, he really enjoys the staff. They have been very supportive to him, but he does want to go home. And so we need to make sure that we follow through what his needs are, and to make sure the family stays updated. Now, he has identified what family members, and he's signed releases for me to be able to talk with them. But we need to be aware if there's anyone else, any family members or someone else that wants to get involved, that we have to make sure those releases are signed. Yeah. He's already identified who he wants to have the information to him if he's unable to talk. So I just need to make sure that as his social worker, that I stay updated on what the process is, when he's going to be released, so we can have everything in place for him and make sure he receives the services he needs to have when he returns home. So I just need to stay up to date when he's going to be released, so we can have everything in place for him.
And I'll work close with you on what kind of services we can get at home too, because that's the social workers that you can help me with that.
Okay, I appreciate that.
You're welcome. Yeah.
Good. As the massage therapist on the team, it sounds like since we're getting him to be a little bit more mobile, that massage can start to play a role. That as PT and OT are working with the patient, he's going to have some aches and pains, and we can help to alleviate some of the soreness. On his wrist, we can work above and below the area. That'll help to keep some blood and lymphatic circulation going. So that'll help with the healing process. And then as he goes home, we'll be able to come in and help him. And eventually, as his bruising decreases and such, we'll be able to work with getting his neck, treating some of the whiplash that he sustained from the accident, and maybe reestablishing some of his cervical curve that may have been lost during that period of time from the muscles that have tensed up, and get them to relax again.